Welcome to Next to Madison, a podcast to help you live your best life.
Next to Madison, I'm your host, Madison Malloy, and I am so excited because we are doing an in-person interview with the world-famous plastic surgeon, Dr. Shafer. We are at his clinic on the beautiful Fifth Avenue in New York City, and he is going to educate us on everything from cosmetic procedures so you can be educated and make sure that you're going to the right provider and doing the right laser to look your best at any age.
It's your host, Madison Malloy, and I have exciting news. My new product is now available on Amazon called Color Your Way to Abundance, a 21-day manifestation guide for wealth, health, and love. This unique coloring journal will help you manifest by coloring in the affirmations while you continue to repeat them. This will help activate these affirmations so they become a reality. Grab your copy today and relax, color, and start manifesting.
Dr. Shafer, welcome to the show.
Well, thanks for having me. It's great to be here and great to talk with you today.
Yeah, I'm so excited. I mean, you're like the famous guy. I can't believe I'm actually up here.
Well, you know, being in New York is such a great environment and so many beautiful people. So it's a really ideal place for plastic surgery.
Well, yes, and people definitely, they want to look good, and there is a statistic that the better you look, the more money you make.
It's definitely something true. And there's something where people are coming in and they come in, they say, what can I do to look better? And they're going back to work or getting back into the dating scene, whatever it is. So, but what we like to do is take each person as an individual because there's all these different standards of beauty and we really want to customize it to each patient that comes in.
Yeah. So when you look at a patient, what do you go for? Is there like a recommendation or do they come in for something specific?
Yeah, so every patient is different, but they'll come in and the first thing I ask them is I say, what do you like about yourself? Because I want to start out positive. I want to hear what they like. And then that leads into other things that might concern them. So then I go, what concerns you? And then they'll point out either little things or generalized things, or they might have somebody made a comment to them about something. But, it's talking to that patient and figuring out the why and then the what, and then doing what needs to be done. And a lot of times it's a combination of things that you have to do. So it's not like one laser that treats everything. You have to look what the issue is, and there might be multiple different things. You might do some non-invasive procedures, you might do some skincare treatment, then you might have a small surgery, and then there's maintenance treatment. So it's not a one-stop shop, like a one-time thing, but it's more of developing kind of your progression or series of treatments over time, and it's your beauty journey, basically.
No, absolutely. So this is the thing, it's been popping up on my TikTok. Yeah. There are people that are like 40 years old that are getting facelifts.
Yes.
Too young or...
So we don't go by age. But that's a good question. You really have to evaluate the patient. And there's part of my job is when to say no. And I definitely say no to a lot of 40-year-olds. But sometimes, we've had a few lately, they come in and they could really benefit from it. And, instead of just puffing up their face with fillers or too many lasers, a little facelift or what we call a lower facelift or mini facelift sometimes is a great option for them because then, it's to look natural and then do maintenance with all those other treatments.
So do you think, because now they're saying like all these people have been doing these fillers and now girls are doing them even younger and even guys much younger. And there's showing that it doesn't really fully dissolve.
Well, you have to do everything in moderation. And so what happens a lot of times is if you only have one tool, the person will always use that tool. But sometimes you need to use all your different tools. And so a little bit of filler, a little bit of Botox, a little procedure, a laser here or there, and the combination, almost like a sushi menu. So patients will come in and I'll have this and this. And I talk to patients, I tell them eventually you're going to do all the above. It's just deciding what order you want to do them in to get the best result.
No, that makes sense. Okay, so let's get into the maintenance or the preventative, the lasers.
Yeah,
the good
definitely.
Stuff. So there's so many lasers. There's the Clear and Brilliant. There's the Fraxels. I don't even know them all. But the one that is supposed to be the granddaddy, the Mac Daddy of all the lasers is the CO2. There's a lot of kind of pushback on that laser because they're saying it thins the skin. And so it actually can cause you to look older.
Well, it's using, again, the right laser for what you're trying to treat. So it's not a one-size-fits-all for everybody. Okay. And there's a more general term now that we have is an energy-based device, because laser is the light. But now we have radio frequency treatments, electromagnetic treatments, ultrasound treatments that all use different forms of energy. And what we're doing is delivering the energy to the skin, and we're targeting it to what we want to treat. So is it pigmentation? Is it vascular? Is it your collagen? Is it your tissue underneath? Like, what is it that we're trying to treat? And then you choose the laser or energy-based treatment that you want to do. And when you're looking at the patient, what type of skin do they have? You know, darker skin, can't do some lasers, can do others. Radio frequency lets us increase the range of patients that we can treat because it doesn't affect the pigmentation as much. So you really have to choose. It's almost like a lock and key. So we have our laser that's good for browns. We have our laser that's good for red colors. We have our laser that's good for texture. And so really picking the correct laser is more important than saying this laser is not good, that laser is not good. It's making sure that you're going to a board certified, qualified dermatologist or plastic surgeon that has the full spectrum of lasers. So again, you're not using that one tool for every problem. You want to use the correct tool for precision.
Right. So do you have a favorite laser?
So my favorite one right now is called the Genius, and it's a fractionated radio frequency treatment. And I do that about once a year on my face. And basically what it's doing, it helps the texture. I get a little bit of tightness. It smooths the skin. It's a very quick recovery. So it's a, 1 or 2 days for me. So that's the one I like. But the reason why I needed it is because I had a little bit of crepey skin around my eyes. So it's perfect for that.
That was hilarious. So, you must have read my mind. We have ESP because that was the next thing I was getting into is the under eye area is very difficult to treat. So what do you recommend? So the Genius?
So again, there's not one answer that applies to everybody, but when you look under the eyes, is it shadowing? Is it hollowness? Is it thin skin? Is it too much vascularity underneath? Is it discoloration of the skin? And so you might not just do one laser treatment or one intervention, but you want to treat the underlying cause. So if there's hollowness, we'll probably do some filler under there. If it's vascularity, we might do some laser or also some filler to kind of camouflage it. If it's skin laxity, we might do a laser or a surgery like a blepharoplasty. And sometimes you'll do a combination. A lot of times I'll do a blepharoplasty to tighten the skin, and then we'll do a chemical peel or a laser to help the color and the texture of the skin as well.
So do you recommend CO2 for under the eyes?
CO2 is nice. And again, CO2 is just a general term, but fractionated is a newer advancement in that. So instead of just one big beam, it's like a whole bunch of little beams hitting the skin. So basically, you're doing targeted burning of the skin, but you have normal skin in between each one. And so that way it heals much faster.
Okay, so it's not thinning your skin and making it look older.
We're actually stimulating our collagen with that.
That's what I thought. But, people have said, no, it actually thins your skin. So.
Well, you can tell people who overdo it with laser and they start to get this very shiny, kind of translucent skin. But really, again, you want to choose the appropriate laser for the skin. And then we have other options, the chemical peel, the radio frequency treatments, IPL, all different kinds of treatments that you can do for patients.
Gotcha. Okay, so let's talk about the radio frequency because there's also been pushback on that. I feel like everyone's got an opinion, right? Yeah. That's the beauty of the internet. But they're saying like it can be bad because it can melt the natural fat that you need to keep a youthful appearance. Is that a myth?
So there is some truth to that, and it's actually used for that purpose in other parts of the body. So for instance, we have like our True Body machine, which uses the radio frequency, and it can help tighten the skin, melt the fat. Also, if you do it deeper, tighten the muscles. So it's really the level at where you're focusing that energy. So again, laser was a general term. Then our more general term would be an energy-based device, but then that's just the device. Now you need to talk about where you're using it, how deep you're focusing that energy, and what tissue it's hitting. And so again, making sure you're using the right machine for the right purpose is what's going to help you maximize your results.
Okay. And so before we get into more of the surgical stuff, what would be your advice to prevent aging? Like, what are the best products to use, all that stuff?
I like hearing you say the word prevention because certainly when people can come in who didn't prevent, there's things we can do. But I'd rather you prevent and minimize as you're aging, and it makes my job a lot easier, right? And so, but if somebody comes in and they're wrinkled, they've been smoking, they have sun damage, it's a lot harder to get them to their goal. So really starting at a young age, eating healthy, protecting from the sun. I think a little bit of sun is good, so you don't have to be obsessive about it.
Yeah.
But definitely, when you look at sun exposure in patients, and there's a great show I was watching one time, and they're talking about twins. One twin went to prison, and one twin was a trucker. And then the show had nothing to do about their skin, but I'm looking at the two twins. The one that was in prison had amazing skin. The trucker on the side of the driver's side had terrible skin, and I'm like, how could that be? And then I'm like, the prisoner's been inside for 20 years.
Hey, there's a silver lining.
Right? So you always have to look for a silver lining for something. But it's true. So things like that. Smoking, I can tell you, when a patient comes in and I look at them, you can always tell that they're a smoker. And, they have that leathery skin, their voice is, raspy. And, we're just seeing the external part of what they're smoking, but internal, it's affecting your blood vessels, it's affecting your collagen, everything else on the inside too. So they age faster. So, the smoking, and then eating healthy and, taking vitamins. We have our whole metabolic center here, which I'm sure we'll get into talking about that as well. But you need to think about the beauty from the inside out. So maximizing your metabolic processes within your body, your hormones. There's so many things happening within your body that can affect how you look on the outside.
Okay. So people should be eating healthy. What do you recommend as far as like skincare products? Like, because people are saying, I have a 12-step skincare product. That's probably too much.
Well, as a guy, I have I always joke, my shampoo is also my soap, is also my conditioner. And so definitely my routine is much simpler than a lot of people. But I think, cleanliness is good. Hygiene is good. To start with, hydration is good, staying hydrated. Moisturizer for your skin, the sun protection, as we talked about. Hyaluronic acid, I'm sure you've heard that. And that's what a lot of those fillers are made out of, but there's topical products with it. Yeah. Retinoic acid, which helps stimulate your collagen as well. Using something like that, you'll see where it says retinol on the ingredients or retinoic acid. Those are always good. And then truly just decreasing the stress on your skin as well. So antioxidants are very helpful too. And, we live in a big city here in New York, and, there's a lot of internal stress, but also external stress from the environment. So, antioxidants can be very helpful, and vitamin supplementations as well.
And when you say antioxidants, are you talking from the food or antioxidants that you put on your skin?
Well, both. I would do both.
What do you recommend?
So, some of the brands I like the best, they're Skin Medica, which is really great. And I think using a kind of medically or scientifically based product, I think is good that you get at your doctor's office versus something you might get at the grocery store, because you really want to look at the science of it, and you don't want to just cover up what the problem is. You really want to look at the cellular health. And so when you have medical grade skincare, you may not see a difference the first couple of weeks when you're using it, because you're working from the ground up. But as you start to shed your old skin and the new fresher skin comes out, that's where you're going to see those improvements. And so the TNS, which from Skin Medica has nice growth factors in it, and a good moisturizer. There's the pigment correction serum, which is really nice. So, but again, it's not just that there's one product that's good for everybody. It's looking at your skin and then deciding what to use, and that's why we have skincare experts here. So we'll have somebody come in, they'll get an evaluation, and come up with a customized plan for the patient going forward. And some patients, 1 or 2 items. Other patients, they want to have a whole kind of, regimen that involves, multiple steps. But you need to make sure you can follow through with those steps. You don't want to end up, there's so many people who say, I have cupboards full of all these things. And also, it just doesn't depend on the price. I mean, certainly we have very expensive stuff and cheaper things, but again, you don't feel obligated just to buy the expensive stuff. It's really getting something that's appropriate for your skin.
Okay.
We have a great dermatologist here as well.
Oh,
so
wonderful.
there's the everyday person, which is normal skin, but with skin conditions too, we take a look at that and help them maximize their skin as well.
That's good. So it's like a one-stop shop.
Yep.
So we're going to get into the metabolic thing, but before we get off that, I just want to talk about exosomes.
Yes.
That seems to be the new buzzword.
Yep. So it's in a category of, again, cellular treatments, and so you have exosomes, you have stem cells, you have growth factors, PRP you've probably heard of, and PRP is where you're taking blood out of your arm, spinning it in the centrifuge, maximizing those growth factors. So all of these different treatments have preparations of maximizing the growth factors or cellular elements that you're injecting back into the patient. So PRP is great because it comes from you. It's your own growth factors. Exosomes have some of those same components, but they're off the shelf. They've been made in the laboratory.
Gotcha.
Then you have purified growth factors. Like there's a great one now, Ariescence, which is a purified platelet-derived growth factor. I'm seeing amazing things with healing, incisions, after laser, really decreasing the recovery time after it. So that's a great treatment. The exosome. So in full disclosure, I had a hair transplant with Dr. Hazen about 7 months ago.
Oh,
and we did exosome. So just the first centimeter right here.
Okay.
But we did exosomes where the hairs were put and where the hairs were harvested, and the healing was fantastic. So I was back at work 2 days later. So there's really these cellular mechanisms that we can really capitalize on that originally were started for reconstructive surgery or treating different conditions, that we can also use it in the aesthetic field to maximize patients' potential.
That's amazing. So you mentioned PRP, but then there's also PRF. What is the difference?
So PRP, again, we take the blood, we spin it in the centrifuge, and it's more like a liquid. So and you can inject it under the skin. You can put it topically. In other fields of medicine, in orthopedics, they'll inject it into your joints. There's so many different things that you can do. And basically, it's pulling all the growth factors that are in your blood in a high concentration so that they can have their effect on the target tissue. With PRF, there's a couple more processes we do to it, and it turns it more into a gel. So it's not a filler, like it's going to add a lot of volume, but it has more structure to it. So that's another one, the under eyes, which we were talking about. So that's a really nice natural way to help rejuvenate the skin under the eyes. So we'll take it, it becomes almost like gel-like, and then we inject it almost like a filler, but again, not to add volume, but to concentrate those growth factors where we want it to help boost the health of the skin.
So that would probably be better than a CO2 maybe.
Again, it depends. So, let's say that's why it's not a one size fits all. But
for me,
so for you, you have beautiful skin, right? The texture is nice, the color is even, all those kind of things, right? So somebody like you, like if somebody like you came in, like everybody should be on Botox. Everybody's a candidate for Botox, and the reason is it helps decrease the stress in your skin, right? So the FDA-approved areas are around the eyes, between the eyebrows, the forehead. There's a new indication now for the neck, which is really nice.
Okay.
And so everybody should get some of that just as prevention and also treatment of their wrinkles. But then you want to look at the volume of the skin. So if you need any contouring, then filler would be really good, the hyaluronic acid fillers. And then if you want to look at the health of the skin, then the PRP I think would be good, or exosomes. Under eyes, the PRF is really nice. And then the texture of the skin. So things that Botox works on dynamic wrinkles, so moving wrinkles. And then different lasers treat different colors. But then texture, you could do a chemical peel. You could do the Genius, which I was talking about, the radio frequency. Or if you want something more aggressive, the CO2, which you were asking about. So it really depends on the skin or the person and what layer you're treating. But we're treating many layers. So under the eyes, again, you might do some volume with filler, you might do some health with the PRF, and then you might do some texturing with a laser or a chemical peel. And then if it's really loose skin, you might do some surgery. And that's why I say it's kind of an all the above kind of treatment, but I don't want to scare people away. It's not like you do it all on the same day, because part of when patients come in, we're helping them on their beauty journey, right? And so they're going to come in. We might start with the Botox, then they'll come back, and then we might do a little filler. And then they'll be like, wow, it looks good, but what about the texture of the color? So then we might do the laser or the radio frequency. Okay. So it's over time, because I want people to have kind of a slow progression and look natural, because if you can tell from across the room that somebody had a treatment or an injection or that kind of thing, that's bad, right?
I agree, right.
And people will come in, they'll be like, I don't understand how all these people look good, but they don't look like they had anything done. That's the goal. You don't want them to look. You don't want them to look like they had something done.
All right, well, then let's talk about lip fillers, because I really don't see any lip fillers that look good. Yeah. It all looks like somebody got sucked in the face.
So again, you're seeing the people with the bad lip job. You're not seeing the people with the good lip jobs, right? And so conservative, natural, maybe a couple steps over time to reach your goal. But and there's a lot of talk now about migration of fillers, right?
And so seems to have
this is the example that I give. Let's say you take a glass and you're filling it up with water, right? Only so much water can fit in there. If you keep putting more water into it, it starts to spill over. Same thing with the filler. So there's only so much capacity for the filler in the lip. So if they keep getting more and more and more injections, it has to go somewhere and it's going to start spreading, right? So it's the skill of the injector, the filler that you're choosing, and the anatomy of the patient. So again, talking to the patient about their goals, what they want, and there's some different techniques that we can do to help with the size and the shape of the lips, but the fillers have different qualities to them. Some of them are hydrophilic, which means they swell up more. So if you want a more of a pillowy or puffier look, then we might use, let's say, Juvederm Ultra, which is very hydrophilic. It'll kind of expand. But let's say you just want subtle, almost like an injectable lip gloss. Like you just want to smooth the lip but not make it look bigger. Then there's one called Volbella. It's more cohesive. It doesn't swell up as much. So choosing the right filler and for the right purpose is very important when you're treating patients.
So why do you think the majority of people that I see out there have this migration? Is it because everybody's going to these med spas to get lip injections now?
You know, I see that a lot. So it's really, you got to be careful. And one thing I say is a little bit is good, a lot isn't better. And I get a lot of patients that come in, we'll treat them, they'll look great, they'll get positive feedback, and then they'll say, I want more. And then, like I said earlier, part of my job is when to say no. And I tell them no. And then they go along their way. And then I see them a month later with like these big lips, because then they went somewhere else. They didn't take my advice. And they're like, Dr. Shafer, I need to fix this now.
Yeah.
So, which, we can fix it because there's an enzyme, especially if you have a hyaluronic acid-based filler like the Juvederm, Restylane, and in those categories. There's an antidote that we can put in that will help melt it or help your body absorb it faster. So there is stuff we can do. But again, it's better. Like we were talking about prevention for the skin, it's better to get the injectables right the first time than to have to fix them later. Yeah. And again, a little bit is good, a lot might not necessarily be better. So it's better to kind of build it up over time or make changes over time rather than like the shotgun approach and do everything all in one setting.
Well, right, yeah, exactly. So it doesn't look totally shocking. But yes, you want to look like you had nothing done.
Exactly. That's the goal for it, right?
Right? Yeah. That's how
I always joke because we have people who got injected other places or had treatments other places and they look kind of crazy, and then I'll tell my staff, I go, get them right into the exam room. Don't let them sit in the waiting room, because otherwise for the next 2 hours I'm hearing from patients, did you treat that person I saw in the waiting room or I saw in the elevator? So we really, I do like to help people, but I like to, for my patients, it's better to get it right the first time around.
Yeah, no, that's very important. All right, so let's talk about your metabolic center.
Yeah.
Because this is a big thing, because I think most places are just kind of fixing the outside like a Band-Aid, right?
Yep.
But you're talking about the prevention really was starting from the inside. So tell us about that.
Yeah, it adds a whole nother dimension to aesthetic treatments. And so while we've had surgery, we've had laser and other treatments that we can do, treating at the cellular and metabolic level really changes the approach for patients. And again, instead of just covering it up or fixing something, we're really addressing the underlying issues. Is there a hormonal imbalance? Is there a metabolic imbalance? Is there a vitamin deficiency? So again, it's not something where you're going to come in and we just give you the same shot to every person or the same IV to every person. We do a whole examination. We do a whole blood panel looking at all your hormone levels, blood levels, vitamin levels, everything, and then customizing a plan for you moving forward to help maximize those metabolic processes. And then talking about the goals. Is your goal to build muscle? Is your goal to lose fat? Is your goal to have more energy? Is it sexual health you're looking for? All these things are a combination of all the above. And then coming up with that plan for them. And I've been on metabolic treatments for about 3 years now, and I can tell you when I see a picture of myself from 5 years ago, I look better now than I looked 5 years ago. I have better muscle tone.
Great.
I have lower body weight than I had before. I have more energy. I sleep better. So all of these things are working inside of the body, which kind of manifest on the outside, and you can see the benefits from it.
Yeah. So when you see a drastic, is it the drop in estrogen that's causing a lot of the rapid aging?
Oh, it can be that.
Okay.
So that, and then men have drop in testosterone, and we all have a balance of estrogen and testosterone as well. So sometimes it's the ratio and not just the absolute level of it. And there's normal ranges, and I'll give you an example like testosterone. It could be anywhere between 200 and 800. Mine was 300. So mine was technically within the normal range, but on the lower end of the normal range. When we boosted it up to about 700, I'm still within the normal range, but I'm on the higher end of the range, but I saw positive effects on my body. So you might go to somebody, like a doctor that's not trained in the metabolic medicine, they'll check your testosterone, like, oh, it's in the normal range, you don't need to worry about it. But really, it's maximizing the level that's best for your body. And same thing goes for estrogen for women and some of the other treatments that we do in the center as well.
That's amazing.
Yeah.
So let's talk about some of these new machines that you strap to your butt or you strap to your stomach, and they give you like 20,000 squats.
It is. And it feels like it. The first time I did it, they turned it on. I'm like, oh, I don't know if I'm going to be able to do this for half an hour. And then, but after a minute, you kind of get used to it. And, but you really feel like you did, a big workout over about 20 to 30 minutes. But it's nice. So they do, but it's not making a permanent change. So it's like you went to the gym. So if you go to the gym for a couple of weeks, you're going to look good, right? But if you don't keep going to the gym, you're going to lose it. And so these machines are nice, but you're doing series of treatments, you're doing repetitive treatments, or regular treatments on a schedule to maintain those results. But what it can do, let's say you're working out and you're dieting and everything, these machines take you to the next level because they're helping you get to where you couldn't be just on the diet and exercise alone. So they're really... For people who are really looking to fine tune, they're fantastic. If you're a couch potato, don't even bother because it's like pouring a little Dixie cup of water on a big fire. You're not going to be able to put it out. But if you're actively doing everything else that you can, and you just you have these trouble areas, or you just want to take it to the next level, that's where these machines are really nice.
Okay, so if you had a flat stomach, those machines could bring out a six-pack?
You could. Yeah.
Did you know that there's a statistic that it's more impossible to have a six-pack? It's less likely statistically to have a six-pack than it is to earn $1 million in 6 months.
Interesting. Wow.
So if you have a six-pack, you should be able to do both.
You should.
Because
that'd be
that's
good.
The harder of the two.
And now everybody on their OnlyFans, they have their
I don't have one.
Their nice bodies. They're making millions of dollars.
Is this a hint?
Yeah.
Well,
if we need another career, right?
Yeah, exactly. All right, so we got to go there because you are known for a very famous procedure called swag, and that stands for a bunch of initials, which I'll let you tell us about. But you can make a guy's dick bigger.
Yeah,
so let's get it.
It's a thing. So. But, I've been injecting fillers in the face and other parts of the body for almost 20 years now. And about 7 years ago, I'm sitting here, I'm injecting somebody's cheeks, and there's a guy sitting in the chair that was there with them. And he's like, can I get that injected in my penis? And at first I'm like, oh my gosh, not another crazy question. And then he's like, no, I'm serious. And then I thought about it for a minute. I said, I don't see why not. And then I said, do you want to be the guinea pig? Just jokingly. And then he said, yeah, let's try it. And so we set up an appointment. He came back. And then, it's kind of all the stars were aligned at the right time. So right around that time was when cannulas, which are like a safer type of needle for injecting, came out. It's like a longer needle. It's perfect for this procedure. The more cohesive fillers came out. So it was a good timing for this procedure to come along. And then, so I did the procedure. I used Voluma, which is a nice cohesive but soft filler. We used the cannula, so you get nice smooth results. And I just put a couple syringes in. And then I don't hear back from him. I'm like, I hope you liked it. And then I get this call. He's like, Doc, I love it, but we need to put a lot more. So it went from something where in the face, you might put like 2 to 4 syringes for the whole face, where like the penis, we start at like 10, 15 syringes at a time. And, I have people with up to 100 syringes in there. So it went from
what?
Yeah. So it went from a procedure that I did maybe once a month, and now we do 4 or 5 a day on injection days. So it's a big procedure. And, I'm a doctor, but I like to, a little bit of a businessman. So one of the things we did is We named it SWAG, so Shafer Width and Girth Procedure. So it's a catchy name.
That's what it says.
And we also have small, medium, large, and extra large. So 5, 10, 15, or 20 syringes. So nobody comes in and says, I want the small penis. They, they want large or extra large, but they need it. And so if somebody comes in and they only want 1 or 2 syringes, I tell them it's like trying to paint your house, but only buying 1 gallon of paint. Like you need to buy enough to treat the whole,
so are
the
you
whole
talking
area.
girth,
Not
length.
Well, so the primary effect is girth, and then over time, because of the weight, you do get more flaccid length and some erect length as well. So
because the thing is not to be inappropriate, but like, what woman wants to sit on a Coke can?
Well, some people want a Coke can, but it's no judgment here. But it's no. But I'll tell you, when I first started doing it, I thought it was going to be people on the smaller end of the spectrum. I thought it was going to be mainly gay guys coming in for it. I'll tell you, we get every demographic coming in: small, medium, large, gay, straight, every ethnicity, every socioeconomic status. It's something universally, and the example I give is kind of like breast implants for women. Like they're an accepted treatment. They're very popular. It helps people boost their confidence. All this kind of thing. The same thing happened with these guys. Some of the most happy patients are these guys that maybe somebody said something to them in the locker room when they were younger, or one of their partners said something, and they kind of lost their confidence. And then we do it, and kind of like the woman who has the new breast implant, so they're dressing better, standing taller. The guys have more confidence and they feel better about themselves.
So when you do this, is it limp or is it erect when you do that?
You can do it either way, and we do it under stretch. You're kind of stretching it and then injecting the filler. And then there's these bandages we put on and everything. So there's a lot that goes into it. It's not the kind of procedure that a new injector should be doing on patients. I have almost 2 decades of experience, and it's more complicated anatomy. It's a dynamic part of the body, so you really have to, know what you're doing, where you're doing it, and how much to do. So
that's but the thing is, if they're doing, you said you had somebody come in and get 100 syringes.
Not at one time. So a total of 100. You don't want to do more than 15 or 20 at a time.
But aren't they like $1,000 a syringe?
Yeah, it's not not cheap. So
if you want a girthy penis, you got to be rich.
Yeah, so like I had one guy said, I could buy a Rolex or I could buy a new penis. So it's
this is true. That is true. Oh my gosh. So, but here's the thing. Fillers don't last. So how often do they have to come back and do this?
So the Voluma or the Veluxa, which we like to use now, is a hyaluronic acid-based filler, so it's meltable. So let's say you did it and you didn't like it for whatever reason, we can melt it. Or the contour issues, we can modify it. They last up to about 2 years, but it's not like it's there for 2 years and then disappears. So what I'm saying applies to anywhere where you're putting fillers. So you fill up the tank, right? But you don't wait for the tank to be on empty before you fill it up again. So even though it lasts 2 years, you might come back every year and a half to kind of top off the tank. So if you, let's say you did 10 syringes to get to your goal, you might come back every year for 5 syringes to maintain it. But I'll tell you, most people come back, they want another 10 because they want to take it to the next level.
So when they're getting a hand job, can people feel the filler?
Well, so it's an interesting question. I didn't ask that specifically, but what we did do is I did it's an FDA approved study on this, and we followed 20 guys for 2 years now, looking at the effects, side effects, and one of the things we did was survey the partners as well as the patient, and it's very high satisfaction on both sides. So it's definitely something where it's enhancing their relationship.
Wow. So the girthier, the better, I guess, is the moral of the story. So what's the recovery time?
Just like any other filler, small chance of bruising, swelling. It is moldable, so you need to be careful for
not to grip it.
A week or so. So I don't know if there's too much information, but if they come in and if there's a little indentation on one side of the penis, I ask them if they're left-handed or right-handed, and most people who come in with indentations have it on the left side of their penis, 3 little indentations. So
that's hysterical. So it's kind of like for a couple days.
Exactly. Or like if you have sex too soon, I always say it's good to mold it. Like we want to mold it while it's settling in, but you don't want to put it in a tight hole because you're going to push it all towards the base. So, during the first couple of days, so you end up, instead of like a cylinder, more like a triangle. So
you can tell which hole it went into.
Yeah, exactly. Right. So anyway, this is, we laugh about it, but it has a positive effect on a lot of people.
Okay.
It's meeting an unmet need. And as a plastic surgeon, I always say that, we have all these tools and training, but then you have to use this creativity to kind of develop procedures. So there's not a right answer for everybody. And we have our toolbox. And if somebody comes with a concern, we can be creative and use our toolbox to kind of address their concern.
So when you said you followed them for 2 years, the FDA study.
Yep.
The partners, what was their interpretation of it?
So they rated it as enhanced sexual experience. And then we asked them questions like appearance and all those kind of things. Did it look bigger? Did it feel bigger? All those were enhanced.
And what's the percentage of straight over?
So, like I said, at first I thought it'd be higher on the gay side of it. It's not. I'd say probably 60% of our patients straight, 40 gay. So. And
are these married men?
Both. So you have married people. You have some couples coming together. I had one lady brought her husband in. He didn't know why he was coming in. And he went for it that day. So obviously he knew underlying that he needed it. But you have married couples. You have guys that just got divorced. Now they're entering the dating scene again. You have younger guys like in their 20s. It's all different things, and people flying from all over the world for it. From everywhere in the world, we've had people.
And so it doesn't change.
It was during the pandemic. There were some guys getting a little bit nervous because time was going on, and they weren't able to come get their refill. And then I'll fly you out to Dubai or wherever they were. I'm like, I can't, but we couldn't travel during that time. So I got some people that were pretty nervous. So.
Oh my gosh! Well, that is amazing.
Yeah, but it's good. But that's one component of what we do.
Yeah.
But it's grown so big. I have dedicated staff that just for those patients, and protocols and everything, and it builds to other things. A lot of those patients end up getting liposuction or tummy tuck or facelift or eyelids. Or the other way around, we have our sushi menu, like I talked about, and we have all these different things that we do here.
I love that, and the clinic is just so absolutely beautiful, and you could tell that it's like you can come here and look your best, feel your best, and, because it's hard to age.
Yep.
It's harder for women than it is for men, which is unfortunate, but it is what it is.
As a guy, I always say I'm so lucky I'm a guy in terms of getting ready in the morning. I could just, put some gel and go, whereas, it's a lot harder for women, but I'm glad we have a lot of treatments that we can do for them. And then the office, I wanted it to feel kind of like we're sitting in the living room right now, like comfortable talking. We're in New York City, so there's a lot of chaos outside, but we're kind of floating above it because we're up high.
Yeah.
We have nice views, and then, light I think is very important for happiness. And so we get light from every direction, but you also need privacy. So we have, glass, a lot of glass elements, a lot of earthy wood elements in here, just to kind of set an environment, which is really great to feel comfortable, welcome, and kind of at peace.
Yeah, well, it's absolutely amazing, and I loved being here, and thank you so much for coming on Next to Madison.
Amazing. It's great.
Where can people book you, find more information on you, all that stuff?
Yeah, so we're in New York City, and we're at 535 Fifth Avenue, which is right by Grand Central Station. So it's very convenient for people in the city or people coming from out of town. Our website is shaferclinic.com, and going to our website is great. Also, Instagram, Shafer Clinic, is really nice. And if you want to call, it's 212-888-7770. And then info@shaferclinic.com is the best email address for us.
Okay. Perfect. Well, thank you so much.
Thank you so much. This is great.
It was so wonderful.
It's really nice. It's a topic that a lot of people like to talk about. And right now, an hour went by so quickly that,
it does, right?
We could keep talking and talking.
Yeah. So, we'll have you back on for something else. So
excellent.
when you come up with the next procedure, we'll do
Perfect.
the metabolic.
There you go. That'll be really nice.
So
and more surgery
so
stuff.
Yeah. And thank you to everyone who is watching. We couldn't do this without you. And we will see you next time to find out who's next.
Okay.
Bye. Hey, your host here, Madison Malloy. Please make sure to subscribe to the show on all podcast platforms, and please rate and review us on iTunes and Spotify. Also, if you have any questions or comments, you can email us at contact@nexttomadison.com. I thank you again for listening. Bye.